much for inviting me to be part of this panel and to be able to share some of this research with you on innovations in home visiting, particularly involving fathers. As Taylor said, I'm Cynthia Osbourne. I'm at the University of Texas at Austin, the LBJ School. And there I founded and direct the Child and Family Research Partnership. And we work closely with several of our state agencies and large nonprofits to provide program evaluation and research for them in the areas of family strengthening, early childhood, which is in home visiting and pre-K and child care, and fatherhood programs, including responsible fatherhood programs, child support, paternity establishment, as well as in child welfare and teen pregnancy prevention. So we do quite an array of programs, but I've had the privilege to evaluate our state's home visiting program since its inception in 2011-12. And from the beginning, Texas really made a commitment to try to make the programs available for the whole family and to focus on making sure that the fathers are involved in the home visiting programs and not just have it be for mothers and children. As Taylor said, Texas is a very large program. It's a very large state, and our program has 3 of the program models that are on the home view list: the nurse-family partnership model, parents as teachers, and HIPPY. And we're in 21 counties, from our rural counties to our big urban areas, all across the state. And we're very demographically diverse, as you know. And so far, we have served more than 10,000 children in our state. So I was brought in to evaluate 2 of our innovative expansion grants, which were to try to both increase father participation and then to understand how involving fathers might help to retain families in our programs. Retention, or staying with the program, is a constant struggle that our programs have to keep our families there. And so we wanted to understand how including the fathers might help to make that better for our families. To do this evaluation, we collected data from all sorts of sources. We have all the program models' administrative data. We surveyed the moms and the home visitors multiple times. We went and we talked with the home visitors and the families, and especially the fathers, to really understand what it is that they thought about these programs and what they get out of them, and how we can better facilitate their involvement. I'm going to share with you 5 of our major findings from the evaluation, and I'm open to answering any additional questions that you have, but covering things such as why is it that fathers come and how it is that we can get them to come more, and the values that the programs have for them. So to begin, to really understand why it is that fathers participate in home visiting programs. And we have a father who can correct me in any way, so I am going to speak for the average Texan. But I think that he would agree that across the board, the fathers tell us that they want advantages for their children. They want to see their children succeed, and they want to have advantage. They want their children to have advantages that they didn't see that they themselves had. And the fathers who were expecting a baby or who were parents of infants, it was really a focus on child health. They wanted their kid to be the biggest, strongest, healthiest kid that they could possibly be, to get that kid off to a healthy start. And they really trusted that the home visitors knew how to make it so that the mom would be healthy and that the baby would be healthy. For the parents of the fathers of our kind of slightly older little ones, the toddlers, they wanted to see that their kids had an advantage when they started school. They loved to be able to see that their kids could identify their name, sing their ABCs, know their colors and shapes. They were shocked that their kids could learn so much so quickly, and that really reinforced for them that their kids are getting a leg up, and they want their kids to do well in school. And all the findings I'm going to be sharing are applied to fathers across the board, whether they're living with their kids and their mom and the child's mother, or whether they're separate from them. We have more information on our fathers who are residential, not always married, but living with the child, than we do on our what we call non-residential fathers. But a lot of those fathers who aren't living with their children and their child's mother are still involved. They're trying to work out the co-parenting relationship, but they care deeply about their children. And so this was kind of across the board that they want to give their kid a leg up. And the second reason is that it's for them. So many of them did not have a father or a positive father in their lives. And you spoke about the parenting skills and harsh parenting skills. And this was repeated again and again from the fathers and the home visitors and the mothers. They wanted to learn a set of skills that they could use with their children that was not harsh. They often commented that their fathers were harsher than they wish they had been. And they are always really surprised at how effective things like timeout or redirection are with their children. And that providing them a better understanding of their children's development, and that a 3-month-old isn't actually crying so that you can't watch the football game. It really helped them to understand what appropriate sorts of disciplinary practices might be for their children. And then we wanted to better understand how it is that our fathers are participating in our programs. How many, how often, and in what ways. And what we found is that fathers are participating in ways that we are not capturing well, especially in our administrative data. We typically count if a father comes to the visit or not. Most of our program models have a way of indicating who is there. And we find that about a third of our fathers, about 37% in fact, are showing up to at least one home visit. And, I don't know if that's a half full or half empty sort of number, but that's about what we see. But when we ask the moms about what the fathers are doing, we find that 3 out of 4 moms are saying, what dads are asking me about that home visit that I had. When they get home, they want to know, what did you learn? Tell me, show me what you did with that child. And about 2/3 of the moms say the dads regularly practice what they were taught with the kid. They're doing the homeworks, if you will. So that reinforces the mom's learning, that being able to teach what it is that she learned in that home visit, and then the dad's applying that and working with the kid. The dads tell all these stories about their little ones running up to them as they come home with their homeworks in hand and saying, here, we learned this, let me show you what I did, and let's practice this together. Or the mom showing the dad how she learned to do something different in terms of feeding or soothing their kid, and they practice this together. And so they're participating in ways that we really haven't been capturing, and I think that we could do a better job of that. When we wanted to explore what it is that prevents dad from participating, the thing that really kept coming up again and again is their work schedule. These are dads who often work regular 9-to-5 jobs or work 2 to 3 jobs, and they're working a lot. And so even if they want to participate, this is a major barrier. In fact, it's a barrier for many of our moms. When they find stable employment, they often fall out of our programs. Most of our programs are offered between 9 to 5 in a regular business day, and that's convenient for the home visitors. They have a life outside of this. And there is some instances in which neighborhood safety after dark is a concern, and so the home visitors want to go earlier in the day. But this is a big constraint to getting dads to show up at the home visits. And I have a quote that I know that we can't see it up here, but the majority of the time I'm working. I've noticed, however, when I'm at the house, my son will pull on me so that I can participate with him and my wife on the home visit. But most of the time, I'm working. And this was just heard again and again about how I would have been there, but I can't. The second primary reason that dads don't participate is that they don't think the program is designed for them. They see it as a program for moms. They think of parenting as something that's offered to the moms. And in fact, that's the way it's really sold to the families. The dads are often not part of that initial sell of the programs. And we have a quote from a dad who says, well, I've attended 2 of the home visits. It was the main priority ones that involved the father, and all the other ones were more like for the mother, like breastfeeding and so on and so forth. And so they really think that the skills that are being taught are primarily geared toward the mother. And our program models that have been more inclusive and try to engage fathers have been much more successful. But these are things that the fathers tell us again and again. It's just not for me. And when we look to see, well, how is it that states or communities can do a better job of improving or increasing father participation? At the end of the day, the short answer is you need to ask them. If you want them to participate, you should ask them to participate. And when the state provided training to the home visitors about the fact that dads may want to be involved in that, having them participate could be a good thing, and that dads add a lot of value to their households, the home visitors had a big shift in the way that they thought about these programs. And then it was reinforced because they would say, hey, Dad, do you want to participate? He was sitting on the couch. And they never thought to just say, come and sit at the table with us while we do this. And he said, okay. And he would get up and he would do it. And that reinforced that you saw that happen. You heard these stories again and again. But we also found in our empirical research that we do have to be really deliberate if we want Dad to show up at the home visit. We have to schedule something around his work hours. That it has to be on the weekend or in the evenings, which is hard because he's tired after a full day of work and not many of us want to, come home, eat dinner, and then have someone come into our house and tell us how to parent for the next hour. You can imagine how that doesn't sit that well when you're trying to get your kids to bed and all those other sorts of things in that kind of witching hour in the evening sometimes. So this isn't simple to do, but that's what that really is. You have to be very deliberate in providing opportunities for Dad to attend that first home visit. But to keep him coming back, what we see is what it is that increases the level of participation is that you have to communicate to him that he matters and that being part of this is good for his kids' development. And too often we're not really sending those strong messages that dads matter. And when home visitors do that, the fathers desire to share and keep coming back. So we also wanted to understand, like I said, why is it that we should really encourage father participation? What is the value at the state level and community level of doing this? Not to mention the family level. And really, at the end of the day, having two parents involved and invested in this program makes it so that the parents are going to get more out of it and that they're going to stay with the program longer. We found that in families in which fathers are participating, they stay on average 7 months longer in our program. So as compared to 10 months, they're staying 17 months. And for our programs that have a problem with retention, this is a really big difference. And we also know that with fidelity to the model, we want parents to get the program. We want them to get all the benefits from the program. And so having them there and participating, having both parents invested, that's going to make the families reap more of the benefits from that investment that we're making in them and will ultimately lead to better child outcomes, which is something that we're testing as we're moving forward. But I'm not sure how I'm doing on time, so.
Oh, but you're doing good.
Okay, but I'm just going to sum up and I can share with you my slides because they have pretty pictures and stuff. But I just wanted to sum up and really kind of reiterate the 5 main points is that dads participate because they want their kids to have advantages. That just like all of us, they really see the value in promoting their children's health and school readiness. And that although a third of our fathers are participating in our home visits, fathers are actually contributing and participating in ways that we're not typically measuring. And that whole value of their engagement is something that we can do a better job at the program level of capturing. They would be there if they could, but their work schedules often get in the way. And so we are going to have to be deliberate if we think that this is something that we want fathers and or working parents to be able to do. And we have to get more creative in ways that can accommodate that. But we also have to make them feel welcome. Our program models, for instance, have only room for one parent on the application. There's not a space for mom and dad. When they mail things to the household, they mail it to the mother. You have the father's contact information. So some deliberate strategies that are pretty simple can make a really big difference to make the fathers feel like it's more about them. And don't forget to ask them if you want them to come. Asking them is really the most effective way to make them come. And if they do, and they participate in our programs, they're going to be more invested. The whole family's going to stay with it. We heard again and again from moms who said, I was getting a little bit tired. I didn't think I could keep going with the program, but Dad said, nope, this is good for the kid. Junior needs this. You stay in the program. They are an advocate for these programs in really important ways, and the families stay invested longer, which is better for our investment and it's better for the child well-being. There are other studies that are ongoing to try to understand father's participation in home visiting and the value that it has. In these handouts that I have some links to, or some identification of that. But there's some that are doing randomized controlled trials now of programs that are have curriculum specific for the father. There are others that are trying to develop a prenatal couple curriculum. And the Urban Institute did a study funded by Lauren and her crew of father participation in home visiting in several states. And the findings really mirror a lot of what we found in Texas. And so we're learning more, but this is something that I think can really add value. And our program models don't need to make very big shifts to probably make a big impact.
I think we